Welcome to the office of Dr. Richard Pavese. Today, Dr. Pavese and I are going to be discussing with you some of the benefits to the silicone gel breast implants. We want to take some time to educate you about the difference between saline and silicone and some of the benefits you can expect with each implant. So Dr. Pavese, let's get started by kind of showing everybody the difference between the implants.
My name is Dr. Pavese. I'm a plastic surgeon, a board-certified plastic surgeon in Tempe, Arizona. We're going to begin by discussing saline implants, and then we're going to discuss the silicone implants. This is a saline implant, and it contains a silicone shell, which is a rubberized shell. The implant is filled with a sterile saline or salt water. The implant is filled during surgery, and there's a fill valve in the back. If this implant were to fail, and we're going to just make a little incision in this implant. If this implant fails, either because of a stress fracture or because the valve fails eventually, the implant would empty in the body, the saline would be harmlessly absorbed, and the implant would be flat.
Now, patients occasionally ask me, what is the chance of an implant failing or rupturing?
Only about 3% of them in 10 years will fail. So that means 97% of the people would be just fine with the implant.
Dr. Pavese, can you tell everyone now about the new silicone gel breast implants?
The silicone gel implant also has a shell of silicone, but it's filled with a gelatinous material. Gel in physics means something that has the properties both of a solid and a liquid.
Now, one of the most common questions I get asked is that when a silicone implant ruptures, what happens? Can it harm your body? A lot of people think the silicone will leak into your body and cause your body harm.
Interestingly, the old silicone gel implant were more like a liquid. This implant I have here is one of the older silicone gel implants. And this implant, if you notice, is not as cohesive as the newer implants. If it fails, it's very liquid-like. Whereas the newer gel implants, this is cut, it's more of a solid, it has no flow to it. So with the newer gel implants, if it ever failed, it pretty much stays in one place, whereas the older gel implants did not have as much cohesiveness to them.
Now, if one were to go flat, could it harm your body in any way?
No, because the silicone itself is safe, and then the body puts a layer of tissue around it. So the characteristics of the new silicone gel is more solid in nature. This is an implant that we stabbed. Notice as I squeeze the silicone out of the implant, it doesn't flow. If I release the pressure on the implant, the silicone goes back in. So if this implant failed, you notice that there's no flow of silicone outward.
So it doesn't leak out into the body?
Doesn't leak out into the body.
So Dr. Pavese, it sounds like patients have a choice between saline or silicone. Is there a time when you would choose one versus the other for a patient?
There are some mechanical characteristics of the two implants that impact patients' results. For example, one of them is ripples. The saline implant, because of some shell stretch, eventually can develop some rippling. And you see the ripples on the side of the implant, whereas the silicone implant, because of the softness of the gel material, doesn't cause rippling to a significant extent. The other thing is, if you notice, this is a saline implant adjacent to a silicone implant. We're going to tilt this implant. As this tilts, the saline implants can displace because of the nature of the water, whereas the silicone implant, because of its a more solid consistency, doesn't displace as much.
So what does that mean for a patient then, that the implant can tend to go outwards towards the armpit
outwards
if they're
towards the arm? The other thing is, if you notice the feel of this implant, the silicone has a certain feel to it, whereas it feels more like natural tissue, where this has like a bounce, typically what water would do. And my recommendation is, the thinner the person is, the less tissue they have, the more I recommend silicone rather than saline.
Dr. Pavese, I'd like to thank you for your time today in answering my question and everyone else's questions. And everyone, today this demonstration was really to show you and educate you about the silicone gel breast implants. We'd like to invite you to our office to come visit Dr. Pavese for a consultation, and that way we can go over more of your personal questions. Please visit our website at www.shapley.com.